Approximately 1/3 of patients who come to our center experience male factor infertility. 1/3 of patients have female factor infertility, and 1/3 of patients actually have characteristics of both male and female infertility. Male infertility is typically diagnosed through a sperm analysis or a semen analysis, which looks at several parameters. The most important being sperm count, sperm motility, which is the percentage of sperm that are progressing forward, and lastly, sperm morphology, which is the shape of the sperm heads, which are very, very important in egg penetration and fertilization. And when you look at all these parameters, you can get a sense as to how much of the sperm issues are participating in this patient's infertility and what are the proper steps of treatment. Do they need to see a urologist first? Are they candidates to go to simple procedures like artificial insemination? Or should we be discussing advanced procedures like in vitro fertilization with microfertilization by intracytoplasmic sperm injection? Very common male infertility issues can be structural, including varicoceles. Very common. These are dilated veins in the scrotal sac that heat up the testicle, damage the spermatozoa, and make them less effective for fertilization. Other structural issues could also participate in male factor infertility. Blockage, production issues, hormonal issues, environmental issues. That is why it's very important to get a detailed history, physical exam, and sometimes consult with a urologist to see if there are any factors that can be mitigated before treatment starts. Many patients actually seek their fertility diagnosis at HRC Fertility. Here we have andrologists and board-certified laboratory personnel like myself to have a quality sperm test to be done. A motility and a morphology, very, very important to be done in a certified laboratory. There are several different treatment options for male infertility. The first would be to see a urologist if there are significant issues with the sperm test, to make sure that there's nothing structural or hormonal that could be corrected for a patient to either spontaneously conceive or to improve the outcome for either artificial insemination or in vitro fertilization. For gentlemen who have failed IVF and ICSI, we can extract sperm from the testicle, or something known as a testicular sperm extraction or a microepididymal sperm extraction. This is done for gentlemen who have a sperm blockage or a significant sperm issue where you cannot see sperm in the ejaculate, but clearly the testicle is producing it, and you can go in and harvest that sperm and use it in conjunction with IVF.